All right, let's get into the side effects of our topical and oral medications for hair loss. This is a very common question I get in my office, and definitely rightfully so. Do you want to be really using these medications if they have side effects that actually bother you? Well, let's talk about those now. Remember, in our most common topical, let's say about 99% of people get a combination of dutasteride and minoxidil combined with salicylic acid. Salicylic acid is a very benign medication unless you're allergic to aspirin, in which case we don't use it because it's just an allergic reaction. But otherwise, it doesn't really cause any side effects. So let's focus on the two other medications, dutasteride and minoxidil. Well, dutasteride, remember how it works. It stops the conversion of testosterone to DHT. DHT is what binds to your hair follicles and causes them thin over time. So if you block testosterone from going to DHT, what you get is an increase in testosterone in the body and a decrease in DHT. The decrease in DHT is beneficial, but what does it mean when you increase the testosterone and decrease the DHT in your body overall? Well, testosterone is linked. Remember, it's the male sex hormone, but it's also found in females. The thing that most of us fear the most is a drop in libido. If you look at the studies of oral finasteride and oral dutasteride both, you'll see there's about a 4 to 5% increase in libido effects, erectile dysfunction, or normal kind of like male, you'll see there's about a 5%, you'll see that about 5% of people reported decreased libido or issues with erectile dysfunction. That's only 5% on oral. Now, theoretically, the topical has less of this effect because less penetrates into the body, but if you look at the studies that show how effective how effective these medications are treating hair loss, they actually do get into the body and decrease the serum or blood DHT levels, meaning that there is some effect. However, I will say, anecdotally, there's way less people that have side effects of libido and erectile dysfunction on the topical versus the oral, but it's still a low percentage of people. The good thing about dutasteride and finasteride is that these side effects, if caught early, are reversible, meaning that if you feel side effects 8 to 12 weeks out or even up to a year out, you can just come off the medication and you'll see a reversal of the effects. Now, dutasteride takes a little bit of time to flush out of the body, so we usually give it 2 months to see if the side effects resolve before considering any kind of dose decreases or some way of getting back on the medication, because it is so beneficial. Remember, 85% protection at 5 years out. It means 5 years from now, you would have maintained 85% of the hairs you would otherwise would have lost. So otherwise, dutasteride has a very minimal side effect profile. That is, the sexual side effects are the ones that people fear the most. Does this affect females? Yes, I definitely have female clients who said their libido has changed on dutasteride, and we switch those people from oral to topical, and they tend to see improvement. Now, moving on to minoxidil. This is a loaded medication that's been around for a long time. There's a lot of myths and a lot of actually truth to the side effects of minoxidil. Number one, minoxidil was initially a blood pressure medication taken as a pill. And while people took it for blood pressure in clinical studies, they found that they had body hair growth, and that's why it became a hair loss medication once it was formulated topically. Now, so we just said that the number one side effect of minoxidil is body hair growth when taken orally, and that's why people tend to like taking it topically. But topically can be a little bit harder, whereas oral minoxidil is very easy to take and it's been found to be pretty effective. There's actually a research study that shows that oral minoxidil is more effective than topical, which is why a lot of people may go that direction. Point being, if you don't have issues with body hair, you probably won't have issues with oral minoxidil. Did I get myself mixed up there? We were talking about blood pressure. Oh, so the other side effect is effect on your blood pressure. It actually turns out that minoxidil is actually pretty crappy blood pressure medication, and that's why I never really made it to the market as one of our ones we use first line. Typically, people will see that they have a couple points drop in their blood pressure. Now, if you're someone who has low blood pressure or you have cardiac issues, you probably want to touch base with your primary care doctor who can follow your blood pressure while you're on this medication. But it is to be cautiously used if you have low blood pressure itself. I think one of the biggest concern with minoxidil is that once you stop using it, your hairs fall out. Well, this is kind of a myth. Minoxidil artificially holds your hairs in the growth phase, letting you to have more hairs that are thicker and longer than being off minoxidil. It does not block hair loss. So when you come off of minoxidil, that hair loss process has been continuing underneath. So you may end up in the same or worse spot after coming off minoxidil if you don't use a blocker like Dutasteride. And that's why I suggest using these two in combination. So those are the real side effects you want to consider. Obviously, every medication has less common side effects. If you have any questions about those, it's really important to refer you with your doctor, or if you're one of our patients, one of us. But we will review your medical history prior to prescribing if you're looking to get the topical oral medications online.